welcome to the medical moment here at Marina Hills Animal Hospital. So I'm going to talk about a case that I had this morning, and it is a 2-year-old male neutered cat who came in with a history of being lethargic for about a month, and also more recently having less of an appetite for the last 2 days, kind of eating about 50% of his meals. There's some changes that have happened in his environment, in his life. The owner got a new cat. The owner went away on a business trip, and there was one other, but now I'm forgetting it. So yeah, so we're kind of going into this thinking, you know, are these some behavioral concerns from the cat not adjusting to his new housemate? She also changed his food a month ago to a weight loss diet, so, you know, is it some of that? But in my mind, I'm kind of thinking, well, the timeline doesn't quite fit because a lot of these changes happened, you know, a month ago, and now it's like, we were eating that food fine, and now why are we not eating it as of 2 days ago? So, you know, in my mind, I'm thinking there's some behavioral concerns here, but there might be something else going on. So, the other part of the history was the cat may or may not have urinated outside of the litter box. She has 2 cats. She doesn't know who's doing what. So we kind of have something to work with, but this is how cases go. A lot of times you have a little bit to work with, and that's why we run tests, because you don't know exactly. This could be a lot of different things happening here. So we started with, let me just check the urine, because you know, if we're peeing outside the litter box, let's make sure there's not a urinary tract infection, for example, even though that's a little less common for a male young cat. Let's just check that, make sure there's no stones in the bladder, that kind of thing. So we put the ultrasound probe on the bladder, and I'm like, what's that? So the technician's like, there's something in the bladder. Well, the bladder itself actually was intact and looked normal, but there was free fluid around the bladder. So someone who, you know, who's not a doctor might think that was actually the whole bladder, but there actually was a normal bladder lining, but there was free fluid outside the bladder. So that's not normal. So here we have now escalated things, because free fluid in the abdomen and the belly is never a normal finding. So here we go, and now we start doing more of a workup. So we are doing blood work in-house because we want those answers quicker. We find on the blood work that the cat has a high globulins, which is a protein, and a normal albumin. I won't go into all the details. And then we performed an ultrasound, x-rays and an ultrasound. So x-ray is going to get the global view of the body, and there is some decreased detail in the abdomen, so that might go along with free fluid, so you don't have as much. If you have free fluid around the organs, then you can't see them as well as detailed. And then we did an ultrasound to assess whether there's any masses in the abdomen that could be leaking out fluid. Are there any big lymph nodes? Are there any enlarged organs? So that's why we do an ultrasound, so you can look at the actual architecture of these things in the belly. So right now we don't have our full answers yet, and I went ahead, by the way, took some of that fluid off, and we'll analyze that and see if there's any abnormal cells in the fluid, what the protein content, what the cellularity content is. But I am highly suspicious, unfortunately for this cat, I'm highly suspicious of an infectious disease called Feline Infectious Peritonitis, FIP. And the reason why, so there is no perfect test for this disease. Well, there is no test for this disease other than taking out tissue that might be infected and doing a special stain and everything. But there's things that make you suspicious for this disease, and the most suspicious one would be the high globulins. So high globulins, when you compare it to the albumin, which are 2 proteins, when that ratio is greater than 0.8, you can pretty confidently say this cat does not have this disease, but it's actually less than 0.8, so that means there's more globulins to albumin. And there are some statistics that say that you can be about 90% confident that the cat has FIP with a ratio lower than the 0.8, but again, it's not a diagnosis, but it's a suspicion. And then other things you have to keep in your mind, because you always have to have all your differentials. Things that can cause high globulins would be other infections, so bacteria, fungal, protozoal type infections, You can have immune-mediated disease. You could have cancer, obviously. You could have, a number of different things. So, so we'll get back all of our testing, and then if it does come back with this suspicion, well, again, we won't get a diagnosis of FIP, but if there's nothing else, and then that's what we're kind of left with. Unfortunately, the prognosis is grave. So these cats will be, will live about weeks, 2 weeks maybe, if they're already having a fusion, which is fluid in the belly. So not very much we can do for them right now. I know there's a lot of studies going on that are looking at potential cures for this, but nothing right now other than trying to keep them comfortable. So I guess backing up a little bit about the disease, so just to give you the broad strokes, so there's a coronavirus, feline coronavirus that lives in the body, like maybe 90-95% of cats have this virus, but the unlucky ones, which is like 10% maybe of them, mutate, and they go into mutate to this virulent strain, which causes that version of FIP. So it's not an infectious concern in terms of it's not contagious, so one cat can't pass it to another cat. It just has to do with maybe you could pass that virus, but many cats live with the virus, but it's your own immune system that is wrecked. That what happens is the body has macrophages, which are white blood cells, and normally the macrophages try to attack a virus, eat it up, and kill it. But if you don't have that immune system, the body is trying to do that, but instead it's just a wreck, and you're getting all kind of inflammatory proteins, and you're getting that's with all the fluid, you're getting all these little granuloma type lesions in all the body, which is probably why this cat's liver is big and everything. So yeah, so that's the story. I hope that we find something else that we can blame it on, but if that's, if there's nothing else, then that's where we're left. So.